Hello, dear learners. Welcome to Exploring an Understanding of how research supports yoga for mental health. Let's set forth on a journey of exploration, gently weaving the threads of research into the fabric of our own knowledge and skills. So whether you're a therapist, a teacher, or simply a seeker of knowledge, I invite you to embrace these moments with a sense of gentle curiosity and openness. I'm your host, Judy Thompson, and in today's segment, we will be exploring the publication Clinical Effects of a Yoga-Based Intervention for Patients with Schizophrenia, a 6-month randomized controlled trial published May 2024 in the journal Schizophrenia Research, authored by Sivarama Varambali, Bharath Holla, Ganesan Venkata Subramanian, Trinath Mullapudi, Praveen Raj, Venkataram Shivakumar, Rita Christopher, Manojit Debnath, Mariama Philip, Rose Dawn Bharath, and Bian Gengadar. Today's episode focuses on a groundbreaking study examining the role of yoga as an adjunctive treatment for individuals living with schizophrenia. Schizophrenia is a complex mental health condition affecting millions worldwide. Traditionally, the treatment of schizophrenia has heavily relied on antipsychotic medications, which are effective at managing symptoms such as hallucinations and delusions. However, these medications often fall short in addressing the negative and cognitive symptoms of the disorder, such as social withdrawal, lack of motivation, and impairments in memory and attention. Emerging research has been exploring non-pharmacological interventions that can be used alongside traditional treatments to provide a more comprehensive approach to managing schizophrenia. One such promising intervention is yoga, a practice that has been around for thousands of years, originating in India, and consists of physical postures, breathing exercises, and meditation techniques. This groundbreaking study was a 6-month randomized controlled trial, and it evaluated the effectiveness of a yoga-based intervention in improving symptoms and quality of life for patients with schizophrenia. This study is particularly significant as it looked at the long-term benefits of yoga, addressing the gap in existing research that has predominantly focused on short-term outcomes. Researchers conducted this large-scale study with 110 participants from an urban and a semi-urban community center. Participants had to meet certain inclusion criteria. They had to be diagnosed with schizophrenia based on DSM-5 criteria and must have been on stable antipsychotic medication for at least 6 weeks before the study began. This stability was crucial for isolating the effects of the yoga intervention from any fluctuations due to medication changes. The primary outcomes this study focused on were the symptom profiles of schizophrenia, which are broadly classified into positive and negative symptoms. Positive symptoms include experiences like hallucinations and delusions, while negative symptoms cover deficits in normal emotional and social functioning, such as lack of motivation and flattened affect. Secondary outcomes were also assessed, including quality of life, perceived stress, and socio-occupational functioning. At the outset, clinical assessments were conducted to establish baseline measurements for all participants. These assessments were repeated at 1, 3, and 6 months to monitor changes over time. Participants in the yoga therapy group followed a structured yoga program developed specifically for schizophrenia. This program featured physical postures, breathing techniques, and meditation, all elements integral to traditional yoga practice, and tailored to meet the needs and capabilities of the patients. These sessions were conducted several times a week under the guidance of trained yoga instructors. Throughout the study, the researchers monitored not only the efficacy of the yoga intervention, but also its safety. At the end of 6 months, the data revealed some important findings. There was a significant improvement in negative symptoms in the yoga group compared to the control group. Negative symptoms like reductions in emotional expression, lack of motivation, and social withdrawal often pose a particular challenge in schizophrenia treatment, so this finding is especially relevant. Participants showed better engagement in social activities, increased motivation, and more pronounced emotional responses as a result of the yoga therapy. Additionally, there were modest improvements in positive symptoms in various aspects of quality of life, such as environmental health and psychological well-being. This study indicates that yoga can be a practical and beneficial add-on therapy for patients with schizophrenia, and it suggests that yoga does not just help in terms of reducing absence or deficits in behavior and mood, but also plays a role in minimizing the more disruptive elements of schizophrenia. Beyond these clinical symptoms, the study also touched on enhancements in the quality of life for the patients who participated in the yoga sessions. Improvements were seen in domains of psychological well-being and environmental health as gauged by the Wohl-Kohl-Breff quality of life assessment. These aspects underscore the holistic nature of yoga therapy, influencing not just the clinical presentation of schizophrenia, but also the subjective well-being and life satisfaction of the patients. Environmental health relates to how an individual interacts with their surroundings, including feelings of safety, financial resources, and access to healthcare, all pivotal elements in a person's overall quality of life. One of the standout elements of the study is the safety profile of yoga as a therapeutic intervention. No significant adverse effects were reported, suggesting that yoga can be safely integrated into the treatment regimens of schizophrenia patients without compromising their physical health. This is an essential consideration, particularly because many pharmacological treatments do have side effects. The implications of these findings reach far beyond the immediate clinical setting. They suggest that yoga can be an effective, low-cost, and low-risk adjunct to standard treatment options. This is particularly relevant for low-resource settings where access to healthcare might be limited. Moreover, the cultural relevance and acceptance of yoga in many parts of the world make it a viable option for diverse populations. Additionally, these findings push the boundaries of traditional treatment paradigms for schizophrenia. They encourage a more integrated approach that considers the mental, physical, and emotional well-being of patients. Yoga, with its blend of physical postures, breathing techniques, and meditation, provides a comprehensive tool that addresses multiple facets of mental health. This study underscores the importance of adopting a non-pharmacological perspective in treating mental health conditions. While medications remain crucial, especially for managing acute symptoms, incorporating practices like yoga can potentially alleviate the chronic burden of the disease, enhance the quality of life, and offer patients a sense of control over their mental health. In exploring the methodology and ethical considerations of the 6-month study on yoga as an add-on therapy for schizophrenia, let's start by examining the rigor that went into the study design. The investigation was set up as a parallel group randomized controlled trial. This type of study design is considered the gold standard for clinical research, as it allows for clear comparisons between intervention and control groups. In this case, the participants were split into 2 groups, one receiving yoga therapy in addition to their usual treatment, and the other receiving only the standard treatment as usual. To ensure the reliability of the results, a key aspect of the study was the use of rater blinding. This means that the evaluators assessing the patient's symptoms were unaware of which group the participants belonged to. Rater blinding minimizes bias and ensures that the observed effects can be reliably attributed to the intervention under study rather than any preconceived expectations. Ethical rigor was also a cornerstone of this study. The research adhered strictly to the ethical standards set forth by national and institutional review boards, the NIMHANS Ethics Committee, and the Ethical Board of the District Mental Health Services. These approvals are critical not only for maintaining trust in the research process, but also for safeguarding the rights and well-being of participants. Consent forms were meticulously crafted and provided to participants, ensuring they were fully informed about the study's nature, risks, and benefits before agreeing to participate. Additionally, the study conformed to the principles set out in the Helsinki Declaration of 1975, as revised in 2008, which is widely regarded as a cornerstone document in the field of research ethics. Compliance with these established guidelines ensured that the study was conducted with the highest standards of ethical integrity, thus enhancing the credibility and reliability of the findings. While the 6-month duration provides valuable insights, longer-term studies are necessary to assess the sustainability of these benefits. Studies that include a wider demographic and different geographical locations could help validate these findings on a larger scale. Moreover, comparing yoga to other active physical interventions such as aerobic exercise or Tai Chi could provide deeper insights into the unique benefits yoga may offer. In summary, this study suggests that yoga offers substantial long-term benefits for individuals with schizophrenia, particularly in reducing negative symptoms and enhancing quality of life. These findings pave the way for more comprehensive, multifaceted treatment plans and highlight the need for further research to optimize and broaden the application of yoga in clinical settings. This research opens up new options for clinicians to incorporate yoga into their treatment plans, providing patients with a more balanced and comprehensive care strategy. Thank you to the authors and publisher for all of the research within this important study. Clinical effects of a yoga-based intervention for patients with schizophrenia, a 6-month randomized controlled trial. For those eager to continue exploring, or for anyone seeking more in-depth information, additional resources and supplementary materials can be accessed within the links provided in the episode description. As we end our time together, remember to embrace and witness the beauty of life, and within shared experience, be the thread that creates compassion and curiosity for others. Thank you for joining me on this journey in learning how research supports yoga and integrative practices for mental health and well-being. May you find and share beauty and peace on your journey toward wellness.